Rosie, a 19-year-old college student. Today, she's walking down the street in the city, heading home from one of her classes. During her walk home, all of a sudden, completely out of nowhere, her body's intruded by an overwhelmingly intense physical response. Rosie's heart is pounding hard, and it feels like something's sitting on her, like she's being smothered. She's finding it very difficult to breathe, and she feels pain in her chest and tingling sensations in her arms. She's feeling lightheaded and dizzy, and her body's beginning to tremble. As these physical symptoms persist, she starts feeling like she's detached from her own body. She begins wondering if this is even real, if any of this is even really happening. We call these types of experiences dissociations. Now, terrifying thoughts are starting to pass through her head. Am I dying? Am I going crazy? What is happening to me? After what seemed like hours, it was only a matter of 5 or 10 minutes or so, the symptoms begin to fade, and Rosie starts to feel like Rosie again. Now, she's left with the puzzling pieces of what just happened to her. In an effort to try and make sense of the experience, Rosie draws the conclusion that she must have had some kind of severe medical issue, like a heart attack. She decides to grab her cell phone and call 911. At the hospital, they run a battery of tests and are unable to find anything that can explain the symptoms she just experienced. This is because Rosie did not suffer a heart attack. No, she suffered what we call a panic attack. Sometimes people experience these traumatic, unexpected panic attacks, and they're able to deal with them effectively and live with them. In other cases, these attacks can deeply affect those who experience them and can develop into panic disorder. Panic disorder is an anxiety disorder where individuals experience recurrent, unexpected panic attacks, and after these attacks, they are consumed by them. Individuals who develop this disorder may experience persistent worry or concern about the attacks, about if they're going crazy, or going to die, or if and when they're going to happen again. They may also experience significant maladaptive changes in behavior. These changes often come in the form of avoidance behaviors, where these individuals avoid all things having to do with panic attacks, including situations, people, and even bodily sensations, like an increased heart rate. Even further, people who experience panic attacks are also at risk to develop agoraphobia. What is agoraphobia? Let's step into the question corner and find out. True or false? Agoraphobia is when a person is afraid to go outside. The answer is false. The idea that agoraphobia is a fear of going outside is a misconception driven by popular media. What is true, though, is that in its most severe form, individuals with this disorder may not feel comfortable to leave their home. So what then is agoraphobia? It is an intense fear and avoidance of situations where escape might be difficult or help might not be available. These situations often include public transportation, being in crowded places like the mall, or enclosed spaces like the inside of a small shop, and leaving the house alone. To wrap this up, I do think it is important to note that while agoraphobia is fairly common in individuals with panic disorder, agoraphobia can also develop in individuals without panic disorder. For instance, sometimes it will develop with other phobias, like a fear of embarrassing oneself in front of others.